Najee Harris suffered a non-contact leg injury today versus the Broncos, in which he was carted off of the field to the locker room. It looks like right now sources have come out and are classifying this as an Achilles injury. The injury replay, which we will look at in a moment, shows that as Harris is going to go back with his left foot in that false step motion, he's going to plant, and while he's doing this, we see what looks like that calf muscle recoil. This, unfortunately, is a very classic injury mechanism for an Achilles injury. We see this time and time again with other athletes. So with today's video, I want to go over the relevant anatomy, talk about the specific mechanism of injury, and then discuss what looks like Najee Harris's future is going to be moving forward. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I am a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they're a little bit easier to understand. I'll also talk about the relevant anatomy for that injury, as well as go into the rehab process. If you enjoy this sort of content and you would like to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered an Achilles injury, please comment in the comment section below. We see here on the injury replay that as Najee Harris is going to step backwards once again in that false step motion, he's going to plant with that left foot, and we see what looks like a recoiling going up his calf muscle. Here I've got a model of the foot and ankle. The ankle joint is going to be formed by two long bones that are going to come down the lower leg. The first one, being the tibia, is going to come down and form the medial portion of the ankle here, known as the medial malleolus. The outside here is the fibula bone that's going to come down and form the lateral portion, known as the lateral malleolus. And as we look on the inside here, this is our talus bone. When we're talking about the Achilles tendon, this is a tendon that's going to be located on the posterior or the back portion of the lower leg. It's important to know that this is made up of three muscles. The first one being our big calf muscle, known as the gastrocnemius muscle. Then there's a muscle slightly deeper to that, known as the soleus muscle. And finally, we have a tiny muscle known as the plantaris. These three are going to come together and attach onto the calcaneus here, forming that Achilles tendon. The Achilles tendon is involved in a few motions at the foot and ankle. The first one that is going to put a lot of stress and stretch through those calf muscles and that Achilles tendon is known as dorsiflexion, where the foot is going to be pointed upwards like this. The opposite that is going to be contracting all of that calf musculature is known as plantar flexion, where we are pointing the foot and toes downwards. There are a couple mechanisms that can injure the Achilles tendon. The first one, if it's any sort of forceful contraction going through that calf musculature. So if a person is going to be cutting, if they're going to be jumping, any sort of explosive plyometric motion right there, that can injure the Achilles tendon, as well as if we're going to get excessive stretch or dorsiflexion of the foot, or a combination of both. So if somebody is going to plant in a dorsiflex position and then they're going to contract everything in that calf muscle, that can absolutely lead to an Achilles injury. As we look again on the injury replay, what's going to happen here is as Najee Harris is going to run forward, he's going to do the classic false step motion where he's going to bring the foot back, plant, and then go to explode forward. However, when he does this, we see in the injury replay that it's going to put his foot and ankle into a lot of dorsiflexion, which, as we know, is going to greatly stretch everything located in that calf. Then when it is in that stretch position, he's going to contract it and try to explode forward, which is unfortunately going to lead to that Achilles injury. If we happen to get a new patient in the clinical setting and we suspect an Achilles injury, there are a couple things we can do to essentially rule in and confirm this. First of all, what we'll do is we'll have the person lie prone. That foot is going to hang over the edge of the table, and we're going to squeeze on that calf musculature. This is known as the Thompson test. What we're doing here is we are basically going to squeeze the muscle, and we're going to look at the foot here. What we would like to see with an intact Achilles is we're going to see that foot go into plantar flexion. If a person does have an Achilles rupture, what we're not going to see is motion at all. And so basically that foot is just going to hang there. Another thing that we're going to do is we're going to palpate the area. We're going to walk ourselves down to where that Achilles tendon is, basically feeling to see if we have any sort of divots in where the tendon should be. Obviously, in a full ruptured tendon, we're going to have a significant divot. If it is an intact tendon, we're going to feel that tendon go all the way down to that calcaneus. Injuries to the Achilles follow that classic grading system of grades 1, 2, and 3. It looks like in this case, because we are seeing an actual recoil again of that calf musculature, that is never a good sign. And when we see this, we will start to immediately suspect a grade 3 or a full rupture of that Achilles tendon. This is because what will happen here is as that Achilles tendon is rupturing, that tendon can recoil going up the calf, and it can be basically visual on an instant replay, which looks like what we're having here. We have seen injuries in the past where calf injuries, such as a calf strain or a calf tear, has led to a recoil, but it looks like, unfortunately, sources are already specifying that Achilles tendon. So based on an injury replay, we either suspect Achilles or calf, but since sources are saying Achilles, then we immediately know that the Achilles is involved here. The MRI is going to dictate the severity of the injury, and that's when we will get the official grade. Basically, when it comes to rehabbing an Achilles injury, we need to know the severity of it so that we can determine the best rehab process. If it is a grade 1 or 2, in a grade 1, you're getting stretching of the Achilles tendon. In a grade 2, you're getting a partial tear. You can essentially start to self-manage symptoms with the rehab. What we're going to do initially is we're going to follow the acronym RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. There may also be a period where the person is immobilized, whether they be in some sort of splint or a walking boot. In a grade 3, unfortunately, this is going to require surgery. And after surgery, this is where we're going to follow the surgical protocol. Because the time frame to return to sport is going to be dictated by the severity, we also need to know the MRI results for that. Unfortunately, in this case, because it's looking like the worst case scenario, and it looks like what we're seeing is the Achilles basically recoiling, going up the back of the leg once again. This is going to require surgery. It's unfortunately going to be the end of the season for him, if in fact it is that grade 3. So we need to wait and see if we get any official results on this. If I happen to get any results, I'll be sure to update everyone in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So unfortunately, it looks like some bad luck for Najee Harris and the Chargers. We wish Najee Harris the best of luck moving forward. We hope that it is not a full rupture, but once again, based on the injury replay and the fact that he needed to be carted off, it seems to be so. Thank you so much for watching my video today. If you enjoy this content, I'm going to go ahead and link one of my playlists so that you can watch some of the videos that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.